Hello, everyone. Welcome to another episode of ASAP Conversations. And as you know, we've started this series to sort of listen to the voices and the perspectives of countries across Asia and even beyond, of how they've been dealing with the pandemic and how, like, everyday lives and how the structures have sort of changed and how we're all struggling to survive in this time. So today we have with us Samiul from Bangladesh. So without much further ado, just introduce yourself. Yeah.
Hi everyone. So I'm Samiul from Bangladesh. Like I just said, I am a part of Youth Aid. We're a youth-led organization working specifically on SRHR and safe abortion, specifically in the context of Bangladesh. And we work with a lot of other youth organizations and youth members in the community. We've been working for the last couple of years. It's originally founded by my friend and colleague Anika, but right now she's on a study break. So in the meantime, you have me to deal with. So yeah.
Great. So also, if you can like share a bit about how the kind of work that Youth Aid does in Bangladesh and how are you involved in the whole, like, especially with regards
Yeah.
to safe abortion. Yeah.
So first off, basically in Bangladesh, it's a really difficult environment to talk about safe abortion. We don't really say that in the sense that we work directly with safe abortion, but rather with MR. So that would be menstrual regulation, because safe abortion is still culturally it's kind of a no-no, because people take it negatively, and it's kind of, since it is kind of outlawed, but the services are there. It is more of menstrual regulation. So we work specifically on that. We do a lot of advocacy activities, be it workshops or seminars with different university groups and students, or we also make a lot of advocacy materials. So specifically, we also make a lot of video material and online content, because a lot of the initial founding members who are still with us today in UTIC, they have a lot of background and experience in media and communications. So we make a lot of media products. We've made a couple of videos, and we were just working on making another one, in fact, until this pandemic hit us. So that's on the back burner for now. But apart from that, we also work directly with the university group of students, because they're the most likely ones to take this forward in the next generations to come. So we work very closely with them.
Okay, that's great. Thank you so much for sharing a bit about that. And like, I know you've sort of given us a context of the situation of accessing abortion in Bangladesh, but that was like my like next leading question. But just to give a bit more clarity in the sense, like you're saying that it is referred to as MR, which is menstrual regulation, and it is people.
Right.
So a bit more about the legalities of it, like, and how the law has sort of evolved. What the kind of challenges the advocates, safe abortion advocates, if if they have been vocal, what are the challenges that they have faced before the pandemic?
So like I mentioned, that it's not abortion here, but it is MR, so menstrual regulation. So MR is completely legal. There are no legal drawbacks to it, that if you are seeking MR or providing MR services, that you will be legally fined or harassed or anything. The infrastructure is there, in fact. The infrastructure is quite good, in the sense that the government is very supportive of it. They've taken a lot of initiatives and measures. So the background is there, but the problem is, in reality, the practice. So the service providers, they are told that you can provide the services without question. So those who seek the services, they have the right to get the services without being harassed or asked questions. However, there is the underlying factor, which is service providers are, of course, human. And humans have different factors kind of converging on them and deciding how they will behave and what they will do. And most of the service providers are intrinsically in nature, just they consider MR or MRM as taboo, or kind of culturally insensitive, or it goes against their beliefs. So they do, in fact, ask a lot of questions. They do, in fact, harass a lot of these people who seek the services. In fact, I know personally a lot of people who have, with good faith, gone to some service providers, which I won't name, but I'm sure you can find that out easily by Googling. But they were supposed to provide the services without question. However, she was harassed to the point where she was asked that, where is your husband? Where is your father? Where is your mother? Where is this or that? I'm not going to give you services without that. And when they raised the fact that, you are supposed to, by law, provide me the services without any question. They said, I won't. You go somewhere else, or just go away, do whatever. So that is a scenario that a lot of people face.
Hmm.
especially in the semi-urban, urban areas, because that is where the services are most provided.
Hmm.
Which brings me on to my next point, which is the people who really need it.
Hmm.
Those who really need it are in the more semi-urban to rural,
Hmm.
or the very diverse population that lives across Bangladesh outside of Dhaka and Chittagong in the
Hmm.
major hubs. They are the ones who really need it because of the fact that we are still suffering from a lot of child marriage, although the numbers are dwindling slowly by thanks to the government's efforts.
Hmm.
But a lot of these people, especially their communities, are still influenced by age-old traditions where their whole life of a woman is to grow up, get
Hmm.
married, have a child. And in this
Yeah.
case, growing up in a lot of cases results in child marriages
Hmm.
or a really early age of at least maybe 18
Hmm.
or before 20.
Hmm.
So because of a lack of knowledge, a lack of community-based knowledge or interventions or practices, this is a common factor. And in many cases, the mother is the victim because a lot of cases there is no proper bed spacing even.
Hmm.
So those who are willing to even have children
Hmm.
through consent and through everything, they are not having proper birth spacing and the mother's life is at risk. And in some cases, when early on they get to know that the mother might be at risk, they do not do anything because the family is pressuring them, what is MR? What is abortion? You can't even consider it.
Hmm.
So that's one of the reasons why in the areas where it is most needed,
Hmm.
services are there to a
Hmm.
scale where you can find them maybe not in your village, but in the closest
Hmm.
district,
Hmm.
district
Okay.
hub. So you
Hmm.
can get those there.
Hmm.
However, over there it's the opposite, where it's the community that is stopping them.
Hmm.
So it's kind of a two-pronged approach. So in the
Yeah.
cities where the people are kind of sensitized about it, they can't get the services because of the service providers. And
Okay.
in the villages, the service providers are there, but the people don't
Don't
get it
want to.
because of
Yeah,
the
it's not an
community.
option. Okay.
So that was the scenario before this whole pandemic.
In terms of Bangladesh's context, what are the hardships that you as an advocate have also seen in terms of accessing abortion, health services, or in the sense like in many countries, domestic abuse, for instance, has really increased, and I think it's in across Asia that has been like a common sort of instance. So yeah, just a bit about what you have experienced and how are you dealing with all of it that's going around and what is the way moving forward. But yeah, we can go into that a bit later. Just like what is the situation right now? Yeah.
So interestingly enough, we never really had a proper lockdown, so to say.
Okay.
It was more of a extended official general holiday.
Okay.
So that itself kind of gives a negative message, doesn't it? It seems like you're all on holiday. You're not supposed to
Yeah.
stay in or
Interesting.
everything.
Oh.
So
Did
there
they
were
actually say it
other,
as a holiday?
yeah.
Okay.
All the news you can check it up in all the
Okay.
news and everywhere. We never had a lockdown. It was just
Okay.
a general holiday.
Uh-huh.
So that's why the government said that you can't go back to work in the offices or anything. Even though it's a holiday, you're still working from home.
Hmm.
So of course they tried to enforce social distancing and staying at home by giving kind of curfews and directives to close down shops and everything within a certain time and
Hmm.
stay indoors, do not go out without masks or without any reason, and so on. So
Hmm.
fine, but we never had a proper lockdown. So
Hmm.
the linguistics behind it is kind of
Right. I mean,
out
Bangladesh
there,
is
right?
amazing in terms of the phrases and the terms that you people come up with. It's pretty cool.
Exactly. So our lockdown or
Hmm.
extended general holiday was actually lifted on last week on Thursday.
Okay.
So that would be
Okay.
31st May.
Hmm.
So life is back to normal. So it seems
Okay. Huh.
everyone's going out and going
Hmm.
back to work. All the public transport is out. So there are
Hmm.
directives to have social distancing and everything.
Hmm.
But right now it doesn't seem to be working much because
Hmm.
nobody is really taking it too seriously. So
And isn't that like sort of
when
affecting the number of increased cases?
Yeah, it's going up
Hmm?
drastically
Yeah.
every day. Each and every day, we're rising. Uh, we cannot really predict how bad it will get.
Hmm. Hmm.
So basically, when the lockdown was there, and a little bit till now as well,
Hmm.
uh, a lot of the services and everything, it was only essential services that are open or available. So that would
Hmm.
be like banks and hospitals, all those, but also in a restricted nature, on a needs
Okay.
basis or in a limited basis.
Okay.
So, getting more specifically about medical services, some things like dentists, physiotherapy, and all these others, they were deemed unessential.
Hmm.
So they were not really easily accessible, and most cases they were just shut down until the general holiday was over. So only the hospitals were left, and in the hospitals that too, it was very limited. So the doctors were limited in scope. Maybe some of them started consulting from their homes over video call, and of course, as our numbers were increasing, it kind of got swamped. The hospitals were overrun with patients, and then the hospitals themselves started panicking. Those who did not have coronavirus or COVID-19, they assumed that they might because of the uh, thermometer, so the temperature check. So they started denying services. So this only leads to a result in SRHR services being on the back burner. It's all about emergency response. It was all about emergency response, and till now it kind of is. So it's specifically just about those who needed fevers and coughs and this and that, and some other essential services like those who have kidney issues, diabetes, heart issues, those common issues that we all face in the South Asian region. So uh, interestingly enough, despite the lack of SRHR services, we did not actually have a lack of SRHR supplies at all. We had a lack of supplies for the COVID-19 response. That would be, for example, the uh, hand sanitizers, masks, gloves. But there was absolutely adequate supplies of contraceptives, be it condoms or contraceptive pills. But that brings me to my thought that is it really because we have a proper supply, or is it because of the underlying issue that we have a lack of practice using these? So maybe the supply was just constant because the demand was still constant. No one really panic bought or did anything. It's just the behavior that did not really change. So it's very well known that you can even find a lot of statistics on it that we have very dwindling numbers of users for contraceptive measures.
Okay.
Medical contraceptive measures. There are contraceptive use, but more of the traditional non-effective ones.
Got it.
Uh, there was no shortage of that. In fact, all the pharmacies and all the hospitals, they kept supplying through their stores and pharmacies. It was open. There was no lockdown for that. There was no crisis in terms of medication for SRHR related issues. There were crises in other medicine because of the logistic issues. So it's quite interesting how the supply is there, but then that is only because of the lack of practice. Because if you notice in a lot of other countries, there were actually shortages of SRHR supplies.
Yes. Stocks were running out. So interesting that that might lead to a very high level of unintended pregnancies, don't you think? Like
yes, definitely, because like you mentioned that because of the home lockdown situation, a lot of gender-based violence has increased.
Yes.
And we as a culture do not understand the term of marital rape yet, or we do not really take domestic abuse that seriously. It's still kind of seen as that, oh, it's okay, you can go and talk it out and fix it and live with your abuser.
Woman has to adjust, and it's your family.
So you're right. In fact, actually, we might see the results of this in the months to come, because if that is the case, then the number of unintended pregnancies might go up, and then it brings in the question that how are the MR services going to be available or respond to this issue? Because of course, a lot of them will not really want to have a child, more so in this situation where it's uncertain if the medical services will be available for childbirth, or if it will be adequate, or if the environment will allow for a healthy child. In fact, because you never know, we don't know the results or the issues that may lead to a child even having the coronavirus from birth. We've heard some cases in the world already, but they've thankfully recovered. But a matter to think about. So, of course, a lot of expecting parents, be it unexpected or intended, they will be worried about this. So, even more so, the services are essential and necessary right now.
Yeah, and if not, then if contraception is not being used as you suggested, then it would only lead to more people using unsafe abortion, because there will be a shortage of then eventually when sort of need it. So yeah, it's interesting to understand that the stock also just for trivia I wanted to ask. So in Bangladesh, in terms of the contraceptives, is that produced locally, or is that exported from some other country? If you would happen to know about that.
No, it is produced locally actually by,
Okay.
I think, as far as I know, there are two or three maybe
Okay.
very big pharmaceutical companies who produce them.
Okay.
And they also do import a couple of them as
Huh.
well.
Huh.
But rather than those, people usually tend to prefer the local ones because they are more affordable.
Mm-hmm.
So thankfully, Bangladesh is one of the few countries who do not have excessively high priced medicine when
Hmm.
produced locally,
Hmm.
because they are in mass supply and
Hmm.
the
Hmm.
supply chain is all fine. The demand is there and they're
Hmm.
using it and supplying it properly.
Hmm.
So it is there, but I do not really know whether or not they will be able to continue the production as usual
Hmm.
in the coming days, given that there is a higher burden on them to produce a lot of PPE and
Yeah.
also COVID-19 related medication.
Hmm.
And the supply chains are kind of
Hmm.
uh, all just thrown into
Hmm.
chaos because of the
True.
COVID-19 situation.
True, true. The priorities have sort of completely shifted towards attending to that, so that has also taken a toll. So thank you so much, Samuel, for sharing everything that's been going on. It's actually interesting to know how Bangladesh has been dealing with this whole situation, and especially the fact that the reason is not that stocks are sort of running out, but is that might be the culture of not sort of using contraception is still inherent. So these things quite interesting to know about. Thank you so much for sharing. Just moving on to the last part of our conversation, basically, which is that okay, so this pandemic has happened. It has really completely turned upside down our basic health infrastructure, our employment opportunities that we give to people, and just the basic the way that we've been living. So, moving forward, how do you sort of see some, I don't know, light at the end of this very depressing tunnel that 2020 is seeming to be like, or especially in terms of advocacy, how do you see that changing? Because a lot of civil society organizations also are working from home, but like we have not been able to organize our youth advocacy institutes, for instance, like a lot of um, capacity building that happens when you all come together, but you're not able to come together physically now.
Right.
So how do you see that changing moving forward?
So since the general holidays were lifted,
Hmm.
everyone is going back to normal. Everything is going back to the way it was. But
Hmm.
that's kind of a concern for me and
Hmm.
the countless experts who have been actually warning against that, because all signs point towards Bangladesh being one of the worst affected.
Hmm.
So in the coming days,
Yeah.
because we are following a trend similar to that of what was seen in Italy and
Hmm.
some other of the worst affected countries. But
Hmm.
we are kind of a couple of weeks or a month behind the rest of the world in terms of
Hmm.
the
Hmm.
number of cases.
Hmm.
So, and we have been seeing a drastic rise in number of cases every day. And I think it's already crossed 50,000 a couple of days ago.
Hmm.
I don't know what the latest statistic is because
Hmm.
it's just depressing following the news.
Yeah.
But not just us, but for the whole world, it seems that we may never really get away from the impact of COVID-19,
Yeah.
because this is a global pandemic and it has been having a global impact. And in relation to that, if we think of the development world, and especially in terms of crisis response, the trend is always clear that whenever there's a new major hot topic, something
Hmm.
else gets pushed aside.
Hmm.
Pushed aside. So uh, in this case,
Hmm.
in our country, we were focusing a lot on gender
Hmm.
and SRHR and a lot of other issues, but now there's no way out of it. It's
Hmm.
the COVID-19 and COVID-19 response that's going to take the lead.
Hmm.
So it is also bringing in a lot of funds,
Hmm.
and a lot of other funds are being transferred into the
Okay.
COVID-19 response as well.
Hmm. Hmm.
So what we have to understand is that we cannot take this opportunity to stop advocating about
Hmm.
SRHR and gender and MR, safe abortion, because
Hmm.
if we do, then it's just going to get blown away completely. No one's
Yes.
going to think of it at all.
Yes.
But it is a
And
very
I think
important
the
issue.
challenges
And
are, like you just said, I think challenges are yet to come, especially with like we had discussed the unintended pregnancies. So that is also something that we have to look
yeah,
out for, right? Yeah. Sorry.
exactly. It's something that we know. It's something that we know is going to come in the near future. So that's something we need to prepare for.
Hmm.
But to what degree can we prepare is another question. And
Hmm.
uh, right now, since so much funds are being focused on COVID-19 and COVID-19 response,
Hmm.
we also have to try to kind of make our space in that as well. Those
mm,
who are advocating for SRHR and gender and MRM, safe abortion,
mm,
we have to relate it to the COVID-19 situation and all the connections it has, because we know for a
mm,
fact that there are so many connections. Like we already
mm,
discussed, that
mm,
there will
mm.
be a lot of unintended pregnancies
Exactly. Yeah.
during this lockdown,
Mm,
and there will be a lot of economic impacts. And
mm,
in maybe a worst case scenario, even the old tradition of marrying off children at an early age for
yes.
financial gain might
Mm,
come back, because
yeah.
that thankfully has been tackled to a degree in the
Mm,
rural areas. We don't
mm,
have dowry, and
mm,
or in a formal means.
mm,
Dowry is illegal still now, but
mm,
given that the economic impact is quite drastic, it might also come back, and that might lead to the necessity of safe abortion and safe abortion opportunities.
mm,
But uh, the point is that we have to kind of reopen the pathways to the dialogue around safe abortion or
mm,
MRMRM,
mm.
because of coronavirus, because of the COVID-19 situation, it has had a huge economic impact,
Yeah.
and it's just a domino effect. One after another, something
Yes.
else is going wrong, and because of
Yes.
that, we've kind of, from wherever we were, we've kind of taken a step back, a huge
Yeah.
step back.
Yeah.
We have to kind of work our way back up to that
Mm,
point, and
mm,
then connect it with the
mm,
COVID-19 response, and then keep
mm,
going forward from there.
mm, mm,
Because for the foreseeable future, it seems that whatever is the hot topic, or whatever is thing that gets most funds right now, is going to be in one way or another related to
mm.
COVID-19.
Yeah.
And it is a challenge to really work on advocacy for this in the coming days,
Mm,
because
mm,
to put it bluntly, if you don't have food on the table, you don't care about anything else. You
mm,
need food
mm,
on the table first. So if the
mm,
economy is going down, if
mm,
people are desperate for work or their sustainability, they won't really care. And who
mm.
can blame them, really?
Yeah.
If we
Yeah.
were in that situation as well, that we
Mm,
were struggling to feed ourselves or our
mm,
families,
mm,
who cares about safe
mm,
abortion or SRHR
mm,
or anything? I'll do whatever it takes to earn
mm.
for my family, earn for my living. And that
Definitely.
is one of the reasons, in fact, that the people were so reluctant to stay indoors, to stay
Mm,
in a lockdown, because they need to work, they need to
mm,
earn. So
mhm.
that is
Yeah.
a challenge that we will be facing. A lot
Yeah.
of people, a lot of families will be put into turmoil,
Mm,
and we need to kind of work our way around that, to be
mm,
sensitive about these issues as well,
mm,
but
mm,
also advocating the importance of SRHR and
mm,
of safe abortion and rights.
mm,
So it's more of a situation where we have to wait to see what the results are, how our country and how the global impact, it'll be coped, and how they can work their way back from here.
mm,
And then we have to, of course, always make a space for ourselves. So as advocates, this is a very difficult time, especially when you're covering topics like SRHR and gender and safe abortion, where it's already always been kind of in one ear and out the other.
yes. Yeah. Yeah. Exactly. Yeah, no, definitely. Very important point that you bring that up here is that even you just said that like people have other issues, like they don't know where their next meal is coming from, so they would be less interested in something about abortion or why it's important, why it needs to be destigmatized. But also, even back here in India, we've seen that people don't really care about COVID as well right now. Like the working class, they
Yeah,
don't care about a disease. They care about they've lost their job. They care about that they don't, like you said, they cannot feed their family. So yeah, and but at the same time, it is also important for the authorities and for the ones who are managing to sort of see that just because we have COVID right now, all other ailments or health needs have not taken a back seat. They all also exist. So how are we going to, cope with that? So thank you so much, Samar. I think it's a tough, long way ahead to sort of figure out how we're gonna balance all of
yeah,
these things out and make sure that, like we said, that safe abortion is still being accessible by people in whichever manner that it is being. So let's see how that goes.